Hi guys, how are you doing? Welcome to our histology lecture. Today we're going to look at the histology of the respiratory system. Right. So the respiratory system is divided into a conducting system, respiratory part, conducting portion that is from your nose and to your good cartilage linings. And then you're going to have the respiratory portion starting from your trachea, going to your terminal, going up to your alveoli. So conducting system it is the nasal cavity, the nasopharynx, the linings, the trachea, the bronchi, the bronchioles, the terminal bronchioles, right? And then the respiratory portion is going to have the respiratory bronchioles, alveolar ducts, the alveolar sacs, and the alveoli, right? So the upper then it is further divided into upper respiratory tract and lower respiratory tract. So the upper respiratory tract is from the nose to the larynx, right? And then the lower respiratory tract, it starts at the trachea, goes to the bronchi, bronchioles, terminal bronchioles, alveolar duct, sacs, and then alveoli. Right. So you can see that the respiratory system is divided into conducting. So this line is for the conducting. Everything that is above here is conducting. Right. So you can see there are no alveoli. You can see just smooth muscle. There are no alveoli or alveolar sacs here. But as you go below this line, you can now see these out pocketing sacs. These are your alveoli. So these are now your respiratory bronchioles. So that's where your respiratory zone um, begins, right? And it goes up until we form the what? The alveoli. Is it? So let's start with the conducting portion. So the conducting portion, its main function is to conduct gases to and from the respiratory surface, right, by conditioning the air through cleaning, warming, and moisturizing the air, right? Remember that when you breathe in the air, it's going to have a lot of particles, dust particles, and it's going to be cold. So it has to be fixed to body temperature, it has to be warmed. So there are certain mechanisms that are within the nose that will condition the air to those properties. Physiologically, the respiratory, the conducting portion is going to have an epithelium. Below the epithelium, you're going to have your lamina propria, which is loose connective tissue that is going to have your fibroblasts, your collagen fibers, your reticular fibers, your elastic fibers as well. And then below the lamina propria, you're going to have a submucosa. And the submucosa of the conducting portion is going to be, it's going to have abundant serous mucus glands, right? And then you're just going to have a dense connective tissue that is called ad, uh, uh, right. So a dense connective tissue that is called adventia, right? Adventia, right? Uh, so you have serosa and adventia, right? Serosa and adventitia, right? So serosa, you're gonna do it when you get to your abdomen, where the outward portion of your gut is gonna be surrounded by visceral mesothelium cells, right? Of of the parietal layer, right? So you have your bronchial tree. So remember, we have the trachea. The trachea is bifurcate at the level of T4, lower body of T4, right, into principal or main bronchi. These principal or main bronchi, right, they are also called the primary bronchi. They further divide into what you call lobar or secondary bronchi. That will be three on the right, two on the left. And then this lobar, they are going to further divide into segmental bronchi. These segmental bronchi, they are gonna invaginate what the bronchopulmonary segment of each lung. So the right lung has 10 bronchopulmonary segments, therefore it has 10 segmental bronchi. The left has 8 bronchopulmonary segments, so it has 8 bronchi, right? Segmental bronchi. And then from segmental bronchi, we're going to have bronchioles, and then we're going to have the terminal bronchioles. So the terminal bronchioles are part of the conducting portion. True. That's where the conducting portion ends. And the epithelium that lines this conducting portion mainly is respiratory epithelium. And respiratory epithelium is always ciliated to the stratified columnar epithelium. That will be having about 5 groups of cells, as you're going to see right here. So you have ciliated columnar cells, right? So you need the cilia, remember, for the mucosal escalator effect, where you need the synchronous unidirectional beating of the cilia away from the lungs towards the epiglottis, right? Sweeping the mucus that would have trapped bacteria, pathogens, that would have trapped dust particles, right? That mucus has to be swallowed. All right. So you have ciliated columnar cells, you have goblet cells that will secrete the mucus, right? By merocrine, right? And then you have your brush border, your brush cells, right? Your brush cells, these are chemoreceptors. These are cells that um, that sense um, that sense differences in chemicals and initiate allergic uh, mechanisms. And then we have basal cells. These are basal cells. These are mitotic, are the ones that will replace the ciliated columnar cells. And then we also have the granule. Those are the 5 cells that make up the respiratory epithelium. So below the respiratory epithelium, you're going to have the lamina propria, and the lamina propria of the conducting portion is gonna have abundance of lymphoid tissue. Remember, because the air that you are breathing in, it can have a lot of pathogens. So before it gets to the lung, it has to meet it has to meet the antibodies, right? So you have a lot of lymphocytes aggregations, right? Right in your lamina propria, especially in the upper conducting zone. But as you go down, the number of lymphoid tissue decreases as you're going down, right? Right. So our trachea, our bronchi, our bronchioles, they have to maintain structural rigidity regardless of different pressures. So you have supporting elements, right? You have collagen fibers, elastic fibers, right? The cartilage, most specifically, it will be a hyaline cartilage, and we also have a smooth muscle. So the smooth muscle is going to increase as you go down. So this is just a histological view of a respiratory system, of your respiratory epithelia. You can appreciate cilia here, right? That will be your apical specialization of your columnar cells, and then you can actually see the nucleus, right, representing the pseudostratified epithelia, right? You can see that all the cells, they will be attaching to the basal membrane. They will be attaching to the basal membrane, though their levels of the levels of orientation of the nucleus differs. You can appreciate goblet cells that will be intercepting the epithelial, secreting mucus, and below here the basal membrane, you're going to have the lamina propria. And you can appreciate this is connective tissue. Why? Because the cells are less than extracellular matrix. So the extracellular matrix of collagen fibers, elastic fibers, reticular fibers are abundant. Now, let's take a look at the histology of the conducting or some of the parts of the conducting system. So let's start with the nasal cavity. So the nasal cavity is divided into two. You're going to have the vestibule and the nasal fossa. What is important is to know the epithelia of the two. So the vestibule, since it will be coming from the outside skin going inside the nose, is going to there's going to be a transition of the stratified of the keratinized of the stratified uh, keratinized squamous epithelia to non-keratinized stratified squamous epithelia. And the nasal fossa is going to have chambers that will be separated by the nasal septum, right? So you can appreciate this is your nasal septum. You can see this is your hyaline cartilage, right? That is a glassy, is it? So you can see this is your nasal cavity, and this is your paranasal cavities, right? Paranasal sinuses, right? You can actually appreciate that these sinuses they are gonna be they're gonna be coming from. All right, so the nasal fossa is gonna have three lateral bony shells that are called conchae. So you have the superior, you have the middle, and the inferior. So what is important is to take note of the epithelia that will be lining these uh, conchae, these lateral bony shells, right? So the superior is associated with the olfactory area. So it's gonna have olfactory epithelia. We're gonna talk about it very soon, right? That will be a superior. But as for the middle and the inferior, it's gonna be lined by your respiratory epithelia, which we just said. That is what? Pseudostratified ciliated columnar epithelia, right? And these the middle and the inferior meatus, they are gonna have vascular high vascular supply, right? In able to condition the air that will be coming in. You understand, right? Right. So we also have a region that is called the paranasal sinuses. These ones, paranasal sinuses, right? So the paranasal sinuses, these are just spaces in the ethmoid, sphenoid, maxillary, and right. So these paranasal sinuses, they will be lined by respiratory epithelia that will be draining into the nasal fossa. So the function is the same: is cleaning, moistening, and warming of the air. Remember, we said there is a high degree of vascularity, right? That is within these paranasal sinuses, right? So it's very important. So we have also what called the nasopharynx. So everything is lined uh, by respiratory epithelium up until to the larynx. So the larynx now, you're going to have a true vocal cords and false vocal cords. So the true vocal cords, these are the ones that have communication that is that are that are responsible for phonation. They are going to be lined by stratified non-keratinized squamous epithelia. Why? Because the epithelia has to be protective to to prevent the abrasion forces of the air when these when these vocal cords are vibrating, right? So the true vocal cords is aligned by stratified non-keratinized squamous epithelia, while the false vocal cords they are lined by respiratory epithelia. You understand? Right. So here, this is a cross section of what you find um, right in your conducting system, the layers. So this you can see this border. This is your cilia. You're gonna appreciate, right? And then this one I can appreciate. This is my basal, the basement membrane, and these are the cells. You can see these cells, these columnar ciliated cells, right? We said there are five groups of cells that make up this ciliated pseudostratified that we call respiratory epithelia. And this is your lamina propria. You can see that your lamina propria, right? That will be loose connective tissue or areolar tissue, right? And then this one, when you start to see the abundance of these seromucous glands, you are now in the submucosa. So the submucosa is going to be lined by seromucous glands. And then if we continue to go, you're going to have a dense connective tissue of adventitia. You understand? So your pseudostratified epithelia, your lamina propria, this is your submucosa with the glands, and then you're going to have your adventitia. So you can see this is also another schematic diagram of your respiratory mucosa. So you can understand this is your epithelium with the goblet cells, with the cilia, and then you can see these uh, cuboidal cells. These are your basal cells, which are responsible for mitotic activity. And then you can actually see this is your loose connective tissue. So this is your lamina propria, right? With the dense, you can see these fibroblast cells that will be secreting collagen fibers and so forth. And then now you can see now we are in the submucosa. And right in the submucosa, what do you have? You're going to have your seromucous glands, right? And the difference between a seromucous gland and a duct, you look at the epithelia. So for a duct, the epithelia is going to be either stratified cuboidal or a simple cuboidal, like this, right? But as for the serous glands, they are going to have a polyhedral shape. You can see polyhedral shape. You can see, right? And then this one is going to be your duct. Is gonna be your duct. Now let's just go to the histology of your trachea and your bronchi. So the trachea and the bronchi, they are all lined by the respiratory epithelia, which is a pseudo-stratified ciliated columnar epithelia with all the properties that we have described above. The glands, they are also going to be found in the submucosa with the aggregations of your lymphoid tissue, right? Will be in the submucosa of the trachea. Right. So the trachea, remember the trachea from gross anatomy, it was made from, it was 11.25 centimeters long, and then it was going to have a 2.5 centimeters diameter with a, with a C-shaped or a horseshoe-shaped 20 Harlan cartilage rings. You remember? Right. And posterior to these rings, they are going to be attached by a smooth muscle called trachealis, a trachealis muscle. And this muscle is responsible for the cough reflex activity. Right. So as we move from the trachea and get to the bronchi, you're going to find that those C-shaped cartilages, they're going to change to irregular cartilages. So that's one of the most important distinction between the bronchi and the trachea. So when you see a histological slide of a trachea, you look at the C-shaped Allen cartilage. But as for the bronchi, you see irregular cartilage, right? And then and there's going to be aggregation of smooth muscle right around your bronchi. In the trachea, the smooth muscle is just in the posterior portion, which is the trachealis muscle. But in the bronchi, you now have the aggregation of smooth muscle surrounding your what? The bronchi. Right. So we see have the epithelia, the lamina propria, the submucosa, and the adventitia. Smooth muscle increases as the bronchi become smaller. So you have to take note there are certain things that increase as you move from the conducting portion to the respiratory portion. One, the smooth muscle. Two, the elastic and the reticular fibers, they increase. And there are things that decrease it as you move from the conducting portion to the respiratory portion. One, that's your elastic. Sorry, that's your glands. So there will be absence of seromucous glands in your alveoli. right? So as you are moving down, you are gonna decrease the number of mucous glands. You're gonna decrease the number of lymph tissues, and then you're gonna increase the smooth muscle, elastic fiber, and reticular fiber. You understand? So this beautiful slide shows your trachea. How? Because I can actually see a C-shaped hyaline cartilage. How do you see this one is a hyaline cartilage? You can see that the hyaline cartilage is glassy. It is glassy. So from inside going outside, I can appreciate my epithelial lining here, which is my respiratory epithelium. You understand, right? And then you can appreciate that this one is gonna be your trachealis muscle, which is a smooth muscle, right? And if I get deeper, you're gonna see your seromucous glands that will be surrounding your submucosa, right? This is another slide for your trachea. You can appreciate your pseudostratified ciliated columnar epithelia, right? This is your lamina propria with alveolar tissue, right? And then now this is your submucosa. You can actually appreciate these seromucous glands in your submucosa. You can see all of these them right, all of these glands, right? And then this eosinophilic layer is gonna be your pericardium, right? Remember your cartilage is avascular, so it depends from the nutrients that are coming from your pericardium. So your pericardium is a dense, irregular connective tissue, right? That is responsible for supplying blood, right, to your cartilage, right? And it also have what you call chondroblast, right? That are going to take place in what you call a positional growth of the chondro of the cartilage. You can actually see these lacunae, your chondrocytes, they will be inside your lacunae, right? When a lacunae is more than two nuclei, it's gonna be called an isogenous group, right? Because a chondroblast will be undergoing mutation, it'll be undergoing mitosis, sorry, and it's gonna divide by what you call interstitial growth. You understand? So another diagram, ciliated columna, your epithelia, your epithelial ciliated columna, pseudostratified epithelia, your lamina propria. You're gonna appreciate your submucosa right here, your pericardium. You can see this layer of eosinophilic, dense, irregular connective tissue, and you can actually see these lacunae, right, with your cartilage, with your chondroblast and chondrocytes cells that will be surrounded by collagen 2 fibers, right? So when it comes to a bronchus, how do you see that is a bronchus? So you can see that there is now more folding of the epithelia, right? So if you compare this one and this one, we've increased the folding. Why? Because we can see this smooth muscle. The folding is due to the smooth muscle. You can see this smooth muscle, smooth muscle, smooth muscle. The smooth muscle is now surrounding. Is not only positioned posteriorly like in the trachea, in the trachealis muscle, right? And you can see irregular cartilages. So this is cartilage over here, cartilage over here, cartilage over here, right? It's irregular. Now let us go and look at the bronchial. So the bronchial, as you are moving from the bronchi to the bronchial, there's gonna be change the of the epithelia. So you'll be decreasing the epithelia, the size of the epithelia, because in the alveoli you have a squamous flat cells. So you have to move from stratified, pseudo-stratified, ciliated columnar to cuboidal, and then you go to flat. So the columnar in the bronchi is what is a ciliated cuboidal. Is a ciliated cuboidal, very important. So you're going to have absence of the cartilage, absence of the glands, absence of the lymphoid tissue. I mentioned this, right? Smooth muscle cells and elastic fibers are going to be more prominent as we are going down in the lamina propria. And the epithelia is no longer for the epithelia is going to be even more folded than the trachea and the bronchi. Why? Because we no longer have the hyaline cartilage, right? So the smooth muscle is going to cause the folding of the epithelia. So in the bronchi, you're going to have autonomic innervation. Remember, our autonomic system is divided into two. You have your sympathetic and your parasympathetic. So in the respiratory system, your sympathetic system nervous supply is responsible for three activities. One, bronchodilation. Two, vasoconstriction. Three, inhibition of secretory glands. That's the activity of your sympathetic innervation. As for the parasympathetic innervation, you have also three activities. One, which are opposite. You now have bronchoconstriction, vasodilation, and secretomotor activity, right? So your parasympathetic activity will be coming from your vagus nerve, while it's your sympathetic activity will be coming from the sympathetic trunk. You understand? Good. So we said as we go down, you're going to have fewer goblet cells. Fewer goblet cells. You understand? Okay. So the goblet cells, they are going to be replaced by a new set of cells called the Clara cells. So Clara cells, they're going to be present starting in the terminal bronchi going down. And these Clara cells, they are responsible for secretion of what you call surfactant. So surfactant is a very important phospholipid fluid that is responsible for lowering surface tension to prevent collapsion of the epithelia of your respiratory system. Right? So those are your Clara cells, right? So the terminal bronchi, they are going to be less than 5 millimeters, right? Less than 5 millimeters. And then they open into respiratory bronchi, that would be less than 1 millimeter, right? So you can now see in the bronchiole, there is no hyaline cartilage. It's abundant smooth muscle, abundant elastic, abundant reticular, but absence of hyaline cartilage. You can understand? And you now have cuboidal epithelium, cuboidal ciliated epithelium. So this is smooth muscle. This is another smooth muscle. Right here, you can now see the epithelium is folded, right? Because there's no hyaline cartilage to support it. And then you can see this loose connective tissue that will be abundant in fibroblasts that will be secreting uh, your collagen type 3, which is reticular fibers, elastic fibers, so forth. You can now appreciate the folding of the epithelia due to abundant smooth muscle and absence of hyaline cartilage. This right here is your vein. You can see this is your vein right here. You can see this is smooth muscle, smooth muscle, smooth muscle, smooth muscle. Understand? Now let's get to the respiratory portion. So the respiratory bronchi, they are gonna give rise to what you call alveolar duct, and alveolar duct into alveolar sacs, and alveolar sacs into alveoli. This is where we have the respiratory portion. So the respiratory portion, or what we call gases, starts at the respiratory epithelium, the respiratory portion, which is the respiratory bronchi. So the respiratory bronchi is going to have outpocketing of alveoli on their walls, right? And then you're going to have low cuboidal epithelia with which is ciliated, and it's gonna have absence of glandular tissue, but abundance of clara cells, which is said are responsible for surfactant secretion. What will be found in the lamina propria? Definitely your smooth muscle, definitely your rich reticular fibers, definitely your rich elastic fibers. Why are these prominent? Because you need the mechanism of recoil of the lung, and this is brought about by elastic fibers. Now, the alveolar ducts and the alveoli will now be lined by squamous epithelia, which is classified as type 1 pneumocytes or type 1 alveolar epithelia. We're going to talk about it very soon. So the alveolar duct and the alveoli, they are supported by a rich matrix of elastic and reticular fibers. We have said this, right? So you can appreciate this is going to be your bronchial and then your terminal bronchi. Once you have the alveoli, it will be a respiratory bronchi, you can appreciate, and then your alveolar duct, the alveolar sac, and the alveoli. And appreciate there's a rich connectivity, there's a rich vascular supply, right, to your alveoli. Remember, this gases exchange, right? So you can appreciate this being your terminal bronchi branching into your respiratory bronchi. You can see outpocketing, and this is gonna be your alveolar duct. Then this is gonna be your alveolar sacs with alveoli. You can appreciate the vein over here. Now, let's now get into the alveoli. So in alveoli, these are sac-like outpocketings of the wall of the respiratory bronchi, your alveolar duct, and alveolar sacs. They are lined by simple squamous epithelia, right, lying on the basal membrane, basal lamina, and they're going to be supported by rich reticular and elastic fibers for expansion during inspiration and elastic recoil during expression. Right. So between two alveoli, you're going to have what's called interalveolar septum. Interalveolar septum. And the interalveolar septum is going to be having those elastic tissue, is going to have abundant capillary network, as well as reticular and elastic fibers. You understand? Right. So there's also a communication between two alveoli, that we say pores of Kahn's. Pores of Kahn. These pores, they are very important because they facilitate communication of or circulation of air. Let's say that one part of the lung, or is it a bronchopulmonary segment, that has been occluded. So air is gonna move in, it's gonna communicate with other respiratory alveoli via these pores of Kahn's. And they also take, take part in equalizing pressure. So equalization of pressure is done by these pores of Kahn's. So here you can appreciate this is your bronchi. Why? Because there is a hyaline cartilage. So this is your bronchus. Your bronchus has no hyaline cartilage. This is now your bronchi. And all of these spaces are your alveolar ducts and your alveolar sacs and your alveoli. You can see this is an artery. This is another artery. You see. Uh-huh. Right. So the structure of an alveolar epithelia is divided into two. Take note of this. So basically, there are three main cells that are within your alveola. There you're going to have, so mainly you're going to have three types of epithelium cells, right? So the first one, you're going to have type 1 pneumocytes, type 2 pneumocytes, and alveolar macrophages. Type 1 pneumocytes are the ones that have squamous shape. They have a squamous shape, which is they are flat, right? And they're the ones that contribute to about 97% of the alveolar surface area. And they are the ones that form the blood-air barrier. You understand? Type 2 pneumocytes, their main function, they have two main functions. One, the secretion of surfactant. Two, they are mitotic, which means they are the ones that replace the, the type 1 pneumocytes if they are worn out. And then we have alveolar macrophages. So alveolar macrophages, they are the ones that will be having uh they will be performing phagocytosis of worn out cells, dusty particles, dusty particles, as well as red blood cells that would have escaped the blood-air barrier, right? So in this diagram, you can appreciate that the type 2 pneumocytes, they are cuboidal, while the type 1 pneumocytes, they are squamous. The type 2 pneumocytes, they have about 3% of the surface area, while the type 1, they have about 97% the of the surface area. You understand? You can appreciate your alveolar macrophage over here, right? And in terms of abundance and population, type 2 pneumocytes, understand this, type 2 pneumocytes are more abundant than type 1 pneumocytes. So type 2 pneumocytes, they have about 60% abundance, but they have 3% surface area. You don't have to confuse the two. You understand? Right. So lastly, as we finish, let's talk about the blood-air barrier. The blood-air barrier. So this is a site where gaseous exchange takes place, and it is about 0.1 to 1.5 micrometer. It's very thin, but it's going to be formed by four features. One, from internal going from the alveolar going to the to the capillary, you're going to have your layer of surfactant, and then from the layer of surfactant, you have your cell membrane and the cytoplasm of your type 1 pneumocyte, and then you're going to have the fused basal lamina of the type 1 pneumocyte epithelium and the endothelium of your capillary. And then now you're going to have a layer of your endothelial cells. Right. So you can appreciate this is your alveolar macrophage. So your blood air barrier is going to be formed by this. This is your type 1 pneumocyte. This is your fused basal lamina. This is your endothelial cells. You see, and these are your type 2 pneumocytes. You can see these granules, which will be having what? Surfactant, right? Good. So, lastly, our clinical correlates, we have Cartagena syndrome, which is immotile cilia syndrome, right? So, this is going to cause infection. Just imagine if your cilia is not moving, there's going to be accumulation of that antiseptic mucus with bacteria and pathogens, right? And then this can lead to inflammation and infection of your respiratory system, right? You can have asthma, you can have emphysema, which is a shortage of your lung tissue due to uh due to because your lung tissue can be damaged by smoke, especially in cigarette smokers. They can have a loss of lung tissue, which is emphysema. You can have a respiratory distress syndrome that is due to insufficiency of your surfactant. And then we have this one that is very important, metaplasia of the respiratory epithelia to stratified squamous epithelia in smokers, right, may lead to carcinoma of the lungs. So a patient who is a cigarette smoker is more likely to have his epithelia, respiratory epithelia, undergoing metaplasia, changing from pseudo stratified columnar to non-keratinized stratified squamous epithelium. So thank you so much, guys. That is what we have today. See you in the next lecture series.